Good afternoon, everybody. It's Dr. Patmos again. It is April 27th, and a very, very, very important study was just published in the Journal of the American Medical Association Pediatrics in JAMA Pediatrics by a very elite group of top tier academic pediatricians and infectious disease experts and epidemiologists. It's a big study, well done, very complicated study, and the results are truly stunning. Here's what this study did. For those of you who don't know, the CDC ACIP a few months ago issued some really awful guidance about neonatal hepatitis B vaccination. Currently, or what had been up until they issued this terrible guidance, the policy was that all babies are vaccinated against hepatitis B, whether or not their mother is hepatitis B positive or status unknown or negative. Every baby gets vaccinated for hepatitis B, and there's a really good reason for that. Well, the ACIP, which had been configured by Robert Kennedy, came up with this awful recommendation that said that the CDC was no longer going to recommend neonatal hepatitis B immunization for babies born to mothers whose status was whose hepatitis B status was negative. So the only people that the only babies that would be vaccinated would be women whose hepatitis B status is positive or unknown. Those who are known negative, what's the point of vaccinating them when the vaccine might have harm, even though there's no evidence that the vaccine has any harm? What the ACIP never considered in the calculation was, what is the risk of not vaccinating these babies? How many cases of acute chronic hepatitis and cirrhosis and hepatocellular carcinoma would result? The ACIP didn't even have data like that and didn't even consider asking that question. The ACIP committee was vice chair was Dr. Robert Malone, who pushed really hard, really hard for this recommendation. I listened to the videotape of the meetings, and he was really the one pushing for this recommendation. So the recommendation went out, and already hepatitis B vaccination rates are falling. Babies are not getting vaccinated against hepatitis B. It's already had the ACIP's guidance has already had an impact. Well, here's what the study that I mentioned said. This was a very complicated study that took the known incidence and prevalence of acute and chronic hepatitis B acquired, at birth, and then projected out how many cases of acute hepatitis B, chronic hepatitis B, cirrhosis, hepatocellular carcinoma, and death would occur per year of babies born under the new guidance. If the new guidance was implemented across the board, how many babies would suffer these horrible consequences, mostly later in life? And the data are stunning. For every 1 year of birth, we would see an increase of 238 cases of acute hepatitis B, 112 cases of chronic hepatitis B, 61 cases of liver cirrhosis, 39 cases of hepatocellular carcinoma, and 62 hepatitis B related deaths. The total cost for this 1 year cohort of babies would be $21.6 million. Now, this is every year. So if you project out over a 20-year period, how many cases of these horrible things would come from this ACIP recommendation? You're talking about nearly 5,000 cases of acute hepatitis B, thousands of cases of chronic hepatitis, cirrhosis, hepatocellular carcinoma, and hepatitis B, hundreds of cases of hepatitis B related death. at a cost of over $400 million, and over a cost of $400 million. So it's clear that the recommendations from the ACIP were horrible, poorly thought out recommendations. Now, the American Academy of Pediatrics and I believe five other organizations, including my own American College of Physicians and American Academy of Family Practice and others, filed suit in federal court to stop these recommendations, and they won. That suit issued a stay and said that the CDC guidance cannot be implemented, that the previous CDC ACIP, which was comprised of actual experts, was illegally disbanded, and that the new ACIP was illegally configured with people who didn't go through a proper vetting process and who the court concluded distinctly unqualified, including the vice chair, Dr. Robert Malone, who the court specifically concluded lacks qualifications and experience, quote unquote, according to the judge. Rather than fight that, Dr. Malone abruptly resigned from the ACIP and has gone back to the comfort and security of his online following and his loyal influencer base. So, but the problem is the damage has already been done. Neonatal vaccination rates against hepatitis have already begun falling. And so some of these bad outcomes are already, the die has already been cast. But it's not too late to stop more damage from being done. Here's what's needed now. In light of this court ruling and in light of the JAMA paper, it's absolutely imperative now that the word go forth publicly, loudly, and clearly to telling the public that these prior ACIP recommendations are null and void. Do not follow them. They are fatally flawed. Following these guidelines will result in thousands of cases of hepatitis and all the related complications from hepatitis B. And we need to rescind the ACIP guidance and revert back to the prior guidance, which is all babies receive hepatitis B vaccination. That needs to be the way it's done if we're going to save these babies from horrible complications later in life. So the take-home message here, and how did this happen? This happened because RFK fired real experts and put in unqualified people. And that's what happens when you put in people who the court says lack qualifications and experience. This is after reviewing their credentials. So this is, I've been arguing about this now, or chiming about this now for 4 or 5 years, that we're putting people in positions of power in public health who lack qualifications, people who haven't done internships or residencies or fellowships, people who are not board certified, don't have medical licenses, don't have any clinical practice experience, and people, vaccine experts who've never had a single vaccine ever approved and in use anywhere in the world. So distinctly unqualified, lacking qualifications and experience. We cannot continue to appoint people to these powerful positions who lack qualifications and experience. This has to stop, because when you do this, when you do that, you get crazy recommendations like this that are so flawed that thousands of cases of hepatitis B would result. If you have never seen a case of acute hepatitis B, then you shouldn't even be opining about this. I've managed many patients with acute hepatitis B. I have seen people die of acute fulminant hepatic necrosis from hepatitis B. I have seen chronic active hepatitis, chronic persistent hepatitis. I have seen thousands of patients with cirrhosis of the liver and with hepatocellular carcinoma. These are bad diseases that come from hepatitis B, and it is utterly, entirely, completely preventable with neonatal hepatitis B vaccination. We need to go back to that. We need to rescind the awful ACIP guidance, and everybody needs to know about this JAMA Pediatrics article. It's all in the text below.